The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us in this dimension of House Call, as it shows on the screen. If you're watching us on TV or see DVD, long-term effects of neck injury session 1. So maybe you've never had a neck injury. We say praise the Lord for that. But maybe you know somebody who has had, and I think this will be very interesting to you, that you can share with them, and or if you've had some neck problems, this will be really very interesting to you. So we're going to talk about the long-term effects of neck injury. We're going to talk about a 15-year follow-up of injuries to the cervical spine or neck by the British Journal of Bone and Joint Surgery. Whiplash injuries, 15 years post-traumatic whiplash trauma. 70% of those people after 15 years complained of original symptoms. So, my esteemed colleague, Dr. Jensen, could you discuss with our viewers and listeners some of the symptoms, the primary symptoms related to post-traumatic neck injuries?
Yes, thank you, Dr. Lala. Well, the neck symptoms are spinal facet injuries. Most common, they have radiating pain that was due to the injury to the vertebral facets. May not be radicular. So what am I talking about? That's pretty technical. Basically, there are joints that are within the spine, and when you have injury to the joints specifically, it'll cause pain right there. Okay, and it doesn't radiate down the arm and things like that. However, other injuries where it affects not just the joints, but the nerves, the nerve roots, then there are characteristic spots where they will refer to, say if it's up in the neck, it will refer to either up in the head or down into the arm and so forth. So some of the more generalized symptoms would be neck pain and some paresthesia in the arms where they're just not feeling as well, with back pains that can occur. Now, these are not just stuff that's regulated to the neck, but it also goes down into the interscapular area or the upper torso of the body. Headaches may be another symptom that's there. Dizziness can occur. Whenever we're talking about neck problems, so that's one of the areas that we regulate balance when you're talking about hand-eye coordination. Well, there's neck-eye coordination also, or neck-ear coordination, and so we get dizzy due to an injury to the neck. Tinnitus, or ringing in the ears, can also occur. And radiculitis is pain that radiates out from those nerves down to say part in the arm. So those are some of the symptoms that can occur. Also, we find that different people are predisposed to different outcomes from this, and what we found is that women or older people in general have worse outcomes after neck injuries. They have a harder time recovering from that. Also, there will be post-traumatic complications that can take place. And 10 to 15 years after an accident, they found that 28% of patients deteriorated if they went on without care for that neck pain. And after 15 years, say 15 to 20 years after the accident, they had 65% of those patients had neck pain, and another 48% of those patients had lower back pain also. See, we find that the neck is not isolated. No part of the body is really isolated. It works together. And so when you have a hard time rotating your neck, where is that coming out from? If you have to turn and look over your shoulder, you're trying to rotate the low back as well. And so the low back doesn't do rotation too well. And so that we find those people also have lower back pain just due to interference with coupled motion, which is a technical term, but how things move in the spine. And that's where you have spine specialists that can help root out those problems as well. Also, we find that in research, they found that in a research article from the Journal of Vertebral Subluxation research in August 2004. Here's an article where they followed 81 patients with multiple sclerosis and Parkinson's disease, and they found that Parkinson's disease and muscular dystrophy was related to trauma. In fact, we find here that 96% of the people with Parkinson's and muscular dystrophy experienced some neck trauma prior to the onset, and 48% had been in automobile accidents, and 35.8% of those people had prior sports injuries. 19.8% had fallen on the ice or on steps. So these are multiple different versions of how those injuries could have taken place. All had subluxations in the cervical spine. Now, a subluxation, as we define it, would be, luxation is a medical term that means a dislocation. When we say subluxation, it is not that the bone is dislocated, but it is malpositioned in there. So with a bone malpositioned, particularly in the spine, with one of the vertebrae being out of position, it can put pressure on different nerves. It can affect the nervous control up and through the neck. So then we want to look at that 91% of those people had muscular dystrophy. And those muscular dystrophy patients, I should say, 91% of those improved with chiropractic care, taking care of those subluxations, helping that nerve flow. And those suffering from Parkinson's disease, 92% of those improved with chiropractic care. Thus says the Journal of Vertebral Subluxation Research in 2004. So it's very up-to-date type of research. Dr. Lala, what about some other long-term symptoms?
Some of the long-term symptoms of whiplash or type long-term neck injuries are 15 years after injury, 80% of the women continue to experience neck and back pain. 50% of the men continue to experience neck and back pain. And between 10 and 15 years, tinnitus or ringing in the ears, as well as back pain increased. And they 54% of them, their symptoms remain static, and 28% worsened.
So static means they didn't change, the symptoms just didn't change?
That's right. So they had just a real chronic problem, 54% of them, but 28% continue to worsen. We see a lot of patients like that, and there's no other help for them other than surgery or drugs, and the surgery may help them temporarily, and the drugs just make them addicted. So it's chiropractic care is certainly a major avenue to that. Now, let's look here at an example of a whiplash type injury. Dr. Jensen is going to run a video of a person, and you'll see that they were struck from the rear. And watch it, and even the glasses are thrown off. So the law of physics say that wherever the force comes from, that's where we go towards it. So the force comes from the rear. Our head whips backwards, and then it whips forward. And this is at 4 miles per hour impact, or 5 miles per hour post impact. So here we go again. Here's the accident. Here comes the injury. There's impact at the rear end. This is even with one of those safety bumpers. Hits the headrest, glasses go flying, neck is injured. Many times people say, well, I have a little stiff neck for a while, or they take some aspirin or some type of NSAID and it goes away, or maybe they'll go and get a massage, or maybe they'll go to a chiropractor or physical therapist and get a little work. Nobody bothers to fully examine them, to really monitor their condition over a period of a time. At least for 1 year post-accident, the condition should be monitored by a chiropractor, for example. So then let's look at some of the long-term results of untreated whiplash injuries. And we can see that it doesn't take much damage there, but some of the long-term results of untreated whiplash injuries include chronic neck and back pains, headaches or lightheadedness, loss of spinal ranges of motion or movement, spinal scoliosis or curvature of the spine, degenerative disc disease, spondylosis, which is a real technical name for spinal arthritis, loss of height because as the discs degenerate they get thinner, and hypolordosis means that instead of they maintaining a normal forward sway, if we look at myself on the side here, we're supposed to have a normal forward sway, but what often happens in the whiplash industry is the neck becomes ramrod like this, and we call that hypolordosis. Another dimension to look at, of course, I've mentioned very briefly here, are degenerative changes. Over a period of months and years, 100% of patients who had experienced whiplash injuries exhibited degenerative changes in the spine and spinal discs. Now, to even make that a little bit more understandable and graphically, Dr. Jensen is going to discuss some x-rays of the cervical spine or neck with you, looking at normal and abnormal issues that are the result of whiplash-type injuries. Dr. Jensen, please.
Thank you, Dr. Lala. Well, if you're looking at the screen here, on the left-hand side we see an X-ray of the spine from the front. And looking at it from the front, we see that there is a gentle curve up here that's taking place. It's supposed to be straight overhead, but what happens is we might have some soft tissue damage or something that changes the person's balance, what have you. We don't know what's going on further down the spine in this case yet because we haven't seen those views, which is important to see how everything is reacting with everything else. But you can see how the head is just not on straight on top of the body. And we might have different tension in the muscles pulling things off to the side. When we look at this the center X-ray, you can see that there's a nice gentle curve, and that's the normal curve in the neck, and that's due to the way that we distribute weight upon the discs and the posterior joints of the spine that helps distribute that weight so that it doesn't cause pain in there. But what happens is many times when we have a soft tissue injury, you can see where these muscles are much easier seen. It's usually because when they're tight, they become more dense, and therefore you can see them much better on a radiograph if it's taken, such that those densities will show up. And what occurs is that we have a loss of that curve of the spine here. And that's generally due to tightening that's taken place in the forward and the backward muscles here, such as would happen in a whiplash case. So,
and a whiplash injury does not necessarily have to be solely related to automobile accident. It could be an athletic injury,
right.
A fall or slip, somebody hugging you, coming up and unexpectedly hugging you could be an issue as well. So it doesn't have to be a car accident, does it?
No, it doesn't. A slip and fall on the ice. Which takes place many times up here with the Frozen Chosen. It's hockey, those kind of sports activities that takes place. You see a man who gets tackled unexpectedly on the football field, those kinds of things.
I know I have one of our grandsons is, what is he, about 5 years old? And he's already taking hockey lessons every Saturday, and I go with him. And even though they have all of this equipment, including a helmet, the Saturday does not go by in an hour's training lesson that one or more of those children doesn't fall backwards and hit their head on the ice. And I've not seen any of them cry or, apparently have some symptomatic injury. But it's interesting to notice that every one of those children, as I observe them, is not participating as fully as they were after they've hit their head on the ice, even though they're wearing a helmet. I mean, I couldn't ask for any more safety measures than the parents and the coaches are requiring for them to be in that hockey league. Right. But it's incredible, and I make sure that after we get the equipment off of our grandson that I always check his spine to make sure that everything is in alignment. And on the occasions that he has fallen on and hit his head on the ice, that's with him wearing a helmet, I always find one or more subluxations in not just his neck, but in his mid and lower back as well. So it's it's nice that he has he certainly doesn't recognize it as a 5-year-old, that he has a grandpa who can look at things like that. But I think of all these other kids, and there must be close to 80 kids filling up that hockey rink every Saturday morning, and numbers of them falling and hitting their heads. And I think, gee, what is happening to these kids? Is this where a lot of these neck problems are going to be when they get a little bit older and older and older and older, you know? So this is where these issues often start in early childhood.
Right.
And of course, if they're involved in some kind of an injury in adulthood, it just aggravates the problem.
Right, and it's been going on for a long period of time.
Long period of time.
Now, one of the interesting things about sports like that, as you said, that their participation seemed to decrease. And when we were talking about radiculopathies before, where it's a difference in sensation, it's just not as sensitive anymore, these kids are meant to react to what's going on in their environment. And if they can't sense their environment as well, they're not going to be able to react as well. And then we find also, if it's a neck injury, they may be off on their balance and makes it even harder to skate. They have to keep their skates wider apart in order to maintain that balance. So it really changes their sports performance.
I see a great deal of that. When I was in college, in undergraduate school, I played soccer on a Hungarian soccer team. And soccer was nothing in America back then. And these were Hungarian immigrants in the United States, and I was about the only kid on the team that was American born. And it is absolutely incredible the amount of trauma your head takes as you're hitting those balls with your head. Incredible amount. And just think of what happens to these football players, hockey players, you know. Baseball, it isn't much like that, but if I had a child or a grandchild who was involved in activities such as skating or football or hockey, for example, or soccer, I'd sure make sure that after every game they were checked out by a chiropractor. I really would. Not because I'm a chiropractor, it's not because I'm promoting it, but in the 40-plus years of practice I've had, it's absolutely incredible the amount of problems these kids have. And these problems show up not only in their scholastic ability. They just don't function as well in the scholastic demands, the normal scholastic demands that are placed upon them, but on the relational aspects as well in relating to others. A lot of these kids that have a lot of anger management problems in school and scholastic problems really have a lot of neck issues, but they go and think well, it's psychological. Just discipline more. You know, put them in a special school. Nothing wrong with putting them in a special school, but very often you do not look at their spine.
Certainly.
Well, we've got a couple other slides that are very, very good as well.
Yes.
Excellent slides.
Well, we're looking also at this case with the cervical hyperlordosis, and what we did was we helped you here with the X-ray. We show a drawing next to it, and this is really going through phases of injury that can take place. What we see is not a lot of bony changes here, but a postural change that takes place, which puts stress on adhesive areas within the spine. If you note here that actually the spinal cord is attached right to the bones up in the cervical area, so it can create areas of tension that can affect the spine all the way down. And in this case, what we're looking at is phase one, of course. It's the start of an injury that has taken place up in here that could be predisposed from a soft tissue, or the soft tissue could be that the nerves are actually making those muscles hyperfunctioning, and if it remains like that, they will become hypofunctioning, meaning that they will have less strength to hold the head up later. Then, as we look further on that, we'll look at phase 4. We've jumped ahead through some of the phases here, but you can see in this case, not only do they still have that rigid neck spine here, that straight, what do we call that again, doctor?
A ramrod spine.
A ramrod spine. And so not only has it been like that, but we start to see some bony changes taking place in here, where we're starting to see some calcifications and narrowing of disc spaces. If you see this space right here that I'm showing you is pretty wide, but then you go down to the next one and it's much thinner, and below that is even thinner. So we're looking at some disc problems, and when those discs collapse, there's less room for the nerves to travel out the holes in the spine, which are found in the posterior neck back here.
So those are referred to as intervertebral foramina, and they act like little windows for the nerves to pass out from the spinal cord out through those little windows or intervertebral foramina, and they go out to supply our tissues then.
Certainly, and actually what happens, the first thing that gets pinched off when there is a malposition of the bones, there is actually the vasculature to the spinal cord itself, which affects it 2 or 3 segments up and 2 or 3 segments below. So it can really affect a large area. In this case, in the neck, it could affect everything from your breathing and your organs, from digestion all the way down.
I think it would be interesting, if it's possible, to bring that slide back up and look at another dimension. If we look up at the top on the x-ray picture on your far right, we see the spinal disc there. And that's a pretty healthy looking disc there. And we move down to the next one, and that's a pretty healthy disc there. But now as we move down to the next 2, you see there's hardly any disc space left there. So there's a tremendous amount of degenerative disc disease there, where the normal space, normal thickness and size and shape of the discs have been lost, as well as out at the front where the little arrow is pointing right now. Those are arthritic spurs, or what we call spondylosis. And so these are serious problems. They're certainly helpable with conservative chiropractic care, but to a large degree they're not curable. But they're kind of like a diabetic who does well on their insulin, but they're never going to be cured. And chiropractic helps millions upon millions of people with these chronic problems every year, keeps them out of surgery and off of drugs, keeps them functional. It extends their life, because when we look up at the brain, all those nerves, arteries, and veins coming out of the brain, if they're not getting the proper nerve and blood supply of the brain, then that person is going to age significantly. They're going to end up with Parkinson's or Alzheimer's or some form of dementia, because they're like an 8-cylinder engine that's only getting gasoline to 4 cylinders or 6 cylinders. So these are significant problems, and very often they're not diagnosed correctly, or they're not diagnosed at all, or that the doctor doesn't have a functional understanding of these issues, or because of insurance limitations or some HMO or something, they're not going to deal with it. They're just going to say, well, you got it, live with it. And that's fine, but it's really a disservice, because there's so many people that are not enjoying natural and good health, long life and good health, because somebody is not looking at them in a comprehensive and thorough way.
Right.
And it doesn't cost a lot of money.
No.
It doesn't cost a lot of money. So what's next there?
Well, we have another phase that we can look at, and this is phase 5. It's just going beyond what phase 4, and we're starting to get into the real deterioration that can take place if the spine is not looked after. And so you're seeing lots of changes in here. In fact, it looks like it's almost a kyphosis, which is an opposite curve from what we're looking for in the normal spine. And you're seeing more deterioration of the discs. Here you see that it's starting to affect up in here into this disc. And in fact, what happens is when one disc or one motor unit, which is basically we're looking at the bone above the disc and the bone below, when they form a functional unit of motion, and when they no longer move, the one above it has to move, some degree further for that. And what happens is when that occurs, you start to get a hyperflexibility in there, and a more of a irritation to those surrounding tissues, and you'll start to get osteophytes there, where the body's just trying to do what's best for you and to cement the area for more stability. And so you find that it climbs up and down the spine.
I know that you realize it, but our viewers don't, that I review a lot of files for potential malpractice claims and of course sexual abuse issues for government agencies. And I would certainly encourage you, this is my opinion based on 40 plus years of experience, I would never allow a physical therapist, a chiropractor, a massage therapist to be doing any treatment on my neck without first having a good, thorough orthopedic, postural, neurological, and physical examination of it. And I'm talking about thorough now. I'm not talking about one of these kiss and run exams, doing a little bit of this, a little of that. Nor would I ever allow anyone to work on my neck or any other area of my spine without adequate full spine x-rays, because if you don't see, you can't properly manage.
Right.
You can't. You're treating blind. And I know that there would be doctors and massage therapists, chiropractors out there, physical therapists who would disagree with that, and the only ones who would disagree with that are the ones who aren't doing it. And I want to tell you, as much experience as these hands have with 40-some plus years, and that doesn't make me better than anybody when I tell you there are no x-rays in these fingers. I can only tell what I'm feeling on the outside, and there is nothing more accurate than an x-ray, for example, that spine, and properly doing the proper accepted tests that are taught in all chiropractic colleges that they're supposed to be doing. Doesn't mean that anybody's going to force the chiropractor to do it, but they really should be done, because you are not saving any money by avoiding being x-rayed. The small amount of x-ray that you would be exposed to is so minimal, it's less than you watching television for a short period of time, because there's all kinds of radiation around us all day long. And if the chiropractor has modern, sophisticated x-ray equipment, that's minimal. It's very minimal. So you're doing yourself a disservice if you're allowing anybody to treat these neck problems without a proper examination, without a thorough examination, without proper x-rays of it, because it can cause problems. And I want to tell you this, the majority of the malpractice cases that I review are because the doctor did not do the usual and customary examinations, did not make adequate x-rays of those areas, and it got people into trouble. And there's no need. Most of these malpractice cases can be just taken care of very easily. So let's talk a little bit more about patients, about the next slide that you have.
Okay, doctor. We have, where we're looking at these statistics, 60% of patients who sought help from medical doctors in the 5 years following the injury were not helped. 18% were forced into early retirement because of neck and lower back problems related to previous whiplash injuries. And chronic physical symptoms cause psychological issues within 3 months. So then we look at those people who are in a lot of pain. A lot of times that forces psychological issues in that regard.
And there's a thing that we call the green poultice.
Right.
The green poultice meaning that if you've been involved in some workers' comp injury or auto collision, and somebody, an insurance company or a representative of the insurance company makes an offer for you to settle before a year post-injury, and the green poultice isn't going to make you feel any better. It may make your wallet feel better for a little while, but it's not going to cure these problems. It's not going to stop these internal problems. And quite frankly, the only one who could possibly and accurately care about your future health is you. And so by listening and watching programs like this, you're adding some internal, more knowledge and wisdom. And of course, where we lack knowledge and wisdom, we're destroyed. We really are. And so to rush off to a settlement is often a major mistake. I'm not accusing the insurance company of being bad. It's their job to save money, to stay in business, to make money for themselves and their stockholders. But you have to look at yourself, and anyone, including a doctor who is encouraging you to settle this so that he or she can get paid quickly and not wait, is making a mistake. And that's my opinion. And I know that there are a lot of practitioners who agree with that, but very few are standing up publicly and saying that. So long life and good health to you. We'll see you on session 2, and we'll...
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.